Hello everyone, it's me, Zoe Hill. So today I would like to go through oral health and oral hygiene with you. I know a lot of us with hidden illnesses take a lot of medication, and because of that we can become prone to dental problems. So I just want to go through some helpful hints to prevent teeth problems. So brush your teeth twice a day, and when you do that, do it in a circular motion. That's because we need to actually brush our gums as well as our teeth. Brush them for 2 minutes twice a day. That's in the morning and the last thing you do at night. Plaque hardens and it turns to calculus and then ultimately gingivitis. And gingivitis is a gum disease, and that's what makes our gums bleed. When your gums bleed, continue to brush that area. It will hurt, but you need to continue to do it. There are specific mouthwashes to take, and you can get them from your pharmacist or like Sainsbury's and your dentists. You need to brush your tongue as well. Because plaque does build up on your tongue, and that's what can cause bad breath. When you buy your toothpaste, look for the fluoride amount in that toothpaste. Don't just look for the whitening amount. You don't just want to look for the aesthetics. You actually want to look for the fluoride because that's what's going to ultimately protect and build up your teeth and keep them strong. Flossing is ultimately important as well because you have 4 sides to your teeth: the front, the back and both sides. Now, food can get stuck in between your teeth, so it's really important to remove that food because otherwise it's going to build into a cavity, and that's what we don't want. Mouthwash is very good because it does actually clean the areas that we can't get to. Now, if you have arthritis in your hands and you struggle to get to the very back of your teeth or at the back here at the front, mouthwash can get to those areas that you struggle with. But don't use mouthwash when you brush your teeth. Use it at, say, lunchtime or tea time. Because mouthwash is washing away the fluoride that you've used when you're brushing your teeth. And fluoride's the most important thing that you want on your teeth. It also makes your breath smell nice, which is quite nice. So mouthwash is a good thing to do, but don't do it when you brush. It also does remove food as well. So it's a good thing to do sort of just after you've eaten. So that's nice. It also gets your mouth to the correct acidity that it's supposed to be. So yeah, after you've eaten is a good thing. It's a good time to use it. If you suffer with TMJ, eating crunchy vegetables is a good thing to do. Now, it might hurt to begin with because obviously TMJ does hurt. This is all the bones along here and these muscles here. If you do suffer with TMJ, it's a nice thing to do to massage these muscles here. But eating crunchy vegetables like carrots will get these muscles moving. And ultimately, that's a great thing to do to exercise these muscles and these bones, and good for the teeth as well to keep them strong. Limiting acid foods and sugary foods like cookies and cakes, that's a good thing to do to stop the plaque and cavities growing in your teeth. And they also wear down the teeth enamel. Also, if you like fresh orange and apple juice, it wears the teeth away. So use a straw because it bypasses the teeth. and it will protect them. Visiting the dentist at least twice a year. If you've got extremely healthy teeth, they may suggest once a year, but also to visit the hygienist. What they will do is clean your teeth and remove any plaque that you have building. Sometimes plaque will hide itself, so you don't always see it, but a hygienist will, and so will your dentist. But they'll remove it for you. I'm just going to go through some foods that are good for your teeth and keep them healthy. But that'll be things like dairy foods, so milk, yogurt, cheese, soy milk, canned salmon, almonds, leafy dark vegetables, eggs, fish. Lean meat is extremely good for your teeth. Nuts, beans, vitamin C, peppers, broccoli, potatoes, starchy foods, and spinach. Oh, spinach is very good for you. So some foods that are bad for your teeth to try and stay away from: cakes, cookies, soft drinks, even sugar-free ones, because they will use artificial sweeteners which do cause teeth decay. Acids, if you're going to drink soft drinks like fresh orange juice, try, like I say, use a straw, but try and drink unsweetened tea. That's the best thing. Pickles, like pickled onions, really bad for your teeth. Wine, dare I say it. Citrus fruits, sports drink, they are so packed with sugar. And dried fruits. Some of the medications, I promised I would go through them. Now, I didn't know whether to go through this with you because I don't want you to stop taking them, because obviously medication does help you. Not everyone thinks that. Some people believe to go naturally, and that's fantastic. I am going to go through these medications with you because I feel like it is good for you to know, but do not change or stop taking your medication without talking to your doctor first. Okay? Antidepressants cause dry mouth. Now, at Boots, there are dry mouth sprays, there's dry mouth gels, and there is dry mouth toothpaste. So you can counteract the symptoms that antidepressants do by taking dry mouth toothpastes. Antihistamines can also cause dry mouth. Blood pressure tablets can cause gum swelling. Chewable aspirins can cause tooth enamel, and they can make your teeth brittle. Asthma medications, they can cause tooth enamel. Chemo medication can cause tooth enamel. Now, we all know that, I'm sure. But you obviously need to take chemo medication. Syrups, obviously children's medication, are packed with sugar. Osteoporosis medication can cause severe medication to your jawbones, so like TMJ. Antibiotics can cause oral thrush and thrush down below. Epileptic medications can cause severe gum tissue to thicken. Now, if you have fibromyalgia, a lot of people take gabapentin and pregabalin, so that will cause gum tissue thickening. Now, the group that I run, Fibromyalgia Research UK, a lot of people mention that they feel they can taste metal and funny things in their mouth. Now that can be caused to your medications. Now, lots and lots of medications have side effects. We all know that. Now, you have to weigh up whether you think the medications that you take are going to be better for you or not. Like I personally take pain medication. I've got lots of things going on, and I do feel that I live a better life not being in pain. But they do have side effects. But I'm prepared to put up with side effects for not living in pain. And I guess you need to think about whether you think you would live a better life living with the side effects, to whether you know, if the tablets counteract that. Everything, you know, anything foreign that you put into your body is going to have an adverse reaction. And you just need to sort of weigh up the pros and the cons on that. Like I say, I didn't know whether it was going to be a good idea to run through the cons basically on those pills. But I do feel it is important that you know that, because I do get asked a lot of questions on our group. And I don't think people do know that it is their tablets that are causing them. That's why I have gone through it with you. But like I said, I don't want you to change your medication without or stop taking your medication without talking to your doctors. Okay, so that is your oral health video today. I hope that you find it interesting. If you do have any questions, then please pop it on this video and I'll answer it to the best of my knowledge. I am a dental nurse, so I do have knowledge on it. So yeah, thank you very much for watching. Have a great day. Take care. Bye bye.